There you are. You're back. 3 weeks into paramedic class, week 3. How exciting. Seems like just yesterday you were week 1, brand new, excited, and here we find ourselves in week 3. Awesome. Good job. So today we're going to talk about the medications in drug exam number 3. These medications are all medications that we would give for a diabetic type patient. The main one we're going to talk about is glucose. Glucose comes in different forms, and we're going to talk about those and talk about what the difference is between them. So the first one that we will talk about is D10. D10 is dextrose. When we talk about glucose and we talk about dextrose, we're really talking about the same thing. There are subtle differences, but within EMS we kind of use that term interchangeably. D10 or glucose is a carbohydrate, and we use it to increase the blood glucose levels. So if we have a diabetic patient who has low blood sugar, we're going to administer D10 or D50, some type of glucose to get that blood sugar up. So the first one we're going to talk about, like I said, is D10. D10 means dextrose 10. What does the 10 mean? 10 means the concentration. So that concentration is based off how much of the medication, glucose, is in 100 milliliters of fluid. Now, you see D10 there, and you look over here at the D10 bag, you see that there's 250 milliliters in that bag. Like I said, in the D10, there are 10 grams of glucose per 100 milliliters of solution. So if we do the math and we look at 250 milliliters times 2.5 times 10, we get 25 grams of dextrose in this IV solution. Now, if we look at D50, we see it's a much smaller container. D50 only has 50 milliliters of solution. So the concentration for D50 is much, much higher. We know based on our life that sugar is sticky. So the difference between D10 and D50 is the concentration. When you deal with D10, it's like water. It's very liquidy. I think that's a word, liquidy. Very watery. How about that? D50 is not. D50 is like syrup. It's really thick. It's really viscous. It's almost as thick as oil. And the problem with D50 is that it's very necrotic on tissue and very hard on the veins. We used to just carry D50, but we started carrying D10 as a better option. Now, when we had to give D50, pushing that 50 milliliters of solution through the IV was physically hard to do because you're basically pushing sugar water through an IV. And if you had a pretty small IV, it was very hard to do. The D10 runs in like any other fluid, so it runs in quickly. But each one of them, D10 and D50, have the same amount of glucose in them, 25 grams. So how would we give that? We would start an IV and we would just run the D10 in. We'll follow our local protocols. Some protocols say just go ahead and give the full 25 grams, the 250 milliliters of solution, and then recheck the blood sugar. Some places will say give 125, recheck, and then if you need to give the other 125, you'll do so. It just depends on where you work, what your local protocols are. But I will tell you that this dextrose is very simple. The body breaks it down quickly. That's great for us when it comes to treating someone with low blood sugar. The problem is that this sugar is broken down quickly, so it doesn't last very long. So if you give someone D10 and they don't want to go to the hospital, we need to assure that that patient is eating something and getting some more complex sugars into their body so they can maintain their increased blood sugar. Because if we give someone D10 and they don't eat, they're going to go right back down about an hour. And what do you know? We're going to be right back out there for the same problem. So it's really important that after we give someone D10, if they don't want to go to the hospital, that we make sure that they eat something good like bread, peanut butter. Those things work great. Now, the next form of glucose we're going to talk about is oral glucose. Hey, what are you giggling for? I see you back there. What are you giggling for? We're going to talk about oral glucose now. So oral glucose is probably something you're familiar with from your EMT class. And in EMT class, we used to document what? That we gave 1 tube of oral glucose. Well, as paramedics, we need to be a little bit more specific than that. So if you notice here, this Instaglucose, it says 24 grams of glucose. This type of oral glucose here is only 15 grams. So we need to give 25 grams in a patient that is eligible for oral glucose. And what is that? Key is the ability to follow commands and swallow on their own. We don't want to be that classic horror story of giving someone oral glucose that is unresponsive and they just kind of choke on the oral glucose. So really, as a paramedic, we very, very seldom will give oral glucose. We'll start an IV and go that route. The next thing we're going to talk about is glucagon. Glucagon is a hormone. It is a hormone that is produced in the pancreas, and it tells the liver to convert glycogen into glucose. So it is a natural occurring hormone that we inject. So why would we give glucagon instead of glucose, D10, D50, whatever it might be? It's when we don't have IV access. If we have someone that we cannot absolutely get an IV on, we will give them glucagon in an injection IM. Now, usually the dose is 0.5 to 1 units. 1 unit equals 1 milligram. And we'll give that IM. Now, if you notice, when we give D10 or D50 to a patient, they wake right up. It's like waking the dead. They wake up over the matter of a couple minutes. Glucagon does not work that way. Glucagon tells the liver to convert glycogen into glucose. And that's how that works. And that takes like 20 minutes, half an hour for it to work. So we don't know if it's going to work or not. So if we give someone glucagon, we need to take them to the hospital because we can't be assured that they're going to wake up. Now, why wouldn't they wake up? You have patients that have liver problems. And if they have severe liver disease, they might not have these stores of glycogen to turn into glucose. But we don't know whether they have it or not. So we give the glucagon and then we go ahead and we will initiate transport to the hospital. Now, you might have encountered somebody who carries glucagon on their own as a rescue device if they have a low blood sugar event. And I just said to you, why do we have to transport somebody who we give glucagon to, but they can give it to themselves or to their family member, and they don't have to go to the hospital, but we have to take them to the hospital. The difference is that when the doctor prescribes the glucagon to that patient to give to themselves or their family member, they assure that the patient's liver is healthy and they have good stores of glucagon built up to be converted into glucose to be consumed by the body. So remember that when someone is given glucagon, we need to take them to the hospital because they just might not wake up because of it. 1 milligram equals 1 unit. Thiamine is the last medication we're going to talk about this week. And thiamine is basically a vitamin. It is a vitamin. It is vitamin B1. And it is given to patients that have a long history of alcohol abuse. And they usually will have low B1 levels, and we will give it to someone with that has chronic alcoholism. If you notice, the duration is the onset's very, very long. It's like an hour or more. So it's not something that we give a lot pre-hospital because we're just not going to see the effects of it. And it's better to give in a controlled environment where we can get some labs first. So we don't give thiamine a lot. We carry it. A lot of agencies carry it, but it's just not given a lot. There is an issue where if you have someone who is a diabetic patient and they're also an alcoholic, if you give them thiamine before you give glucose, you can cause what's called Korsakoff syndrome. And I don't want to get into the nitty gritty of that, but it's basically a form of amnesia / confusion / altered mental status. So we don't tend to give thiamine much pre-hospital. The dose is a wide variety depending upon your local protocols, anywhere from 5 milligrams to 100 milligrams. So that's a huge range that we see in that. Yeah, that's all we have for this week. Good luck with drug exam 3, and we will see you soon.